So an anterior cervical discectomy and fusion is typically performed for somebody with either a degenerative disc that has a bone spur pushing on the nerve, or a herniated disc that's impinging on the nerve, causing arm pain, numbness, and weakness. The approach is through the anterior portion of the neck, where a small incision in one of the creases in the neck are performed. There's a space between the medial musculovisceral fascia and the carotid sheath that is a natural plane to approach the front of the spine. That allows us to remove the disc, remove any bone spurs, decompress the nerves, and then stabilize that segment with a piece of allograft bone and plate. So the goals of anterior cervical discectomy and fusion are to decompress spinal nerves that go to the arms, stabilize the spine. It sometimes can be used to actually decompress the spinal cord itself. So anterior cervical discectomy and fusion indications include cervical radiculopathy, disc herniations, and cervical foraminal stenosis. Occasionally we'll treat cervical myelopathy, which is compression of the spinal cord, with anterior cervical discectomy and fusion as well. It's similar to risks for any spine fusion procedure. They include things like death, paralysis, infection, bleeding, pain, need for future surgery, risks of anesthesia, risks of spinal fluid leak. Most people have a little bit of hoarseness or a little bit of difficulty swallowing immediately after surgery because they have a sensation that there's a swollen lump in the back of their throat because there's a swollen lump in the back of their throat. But that typically goes down and will resolve with time. But the fundamental risk is that that can persist. There's a very small risk that the bone might not heal in an anterior cervical discectomy and fusion. Typically, that's in patients who smoke or have low vitamin D levels, which is why we supplement all our patients with calcium and vitamin D both preoperatively and postoperatively. So with anterior cervical discectomy and fusion, there is some loss of cervical range of motion, although it tends to be relatively small, because we're typically fusing pathologic segments, so you're not fusing segments that move normally, you're fusing segments that are already somewhat stiff and not moving normally. So the benefits of anterior cervical discectomy and fusion is that it's a very high percentage successful surgery and minimizes the risks of further degeneration at that level or further nerve compression at that level. The downfall of fusing the spine is that we do put additional stress on the adjacent segment, so there's always a risk for adjacent segment degeneration. So the expected recovery time after an anterior cervical discectomy and fusion is approximately 3 months for the bone to heal. Once again, we're asking 2 separate bones in the spine to grow together and become one solid piece of bone, and that takes a minimum of 3 months. Return to work depends on your activity level and what you do at work. Desk work, people can return to work typically within 2 weeks. For 1-level fusions, we don't even use a collar. For 2-level or greater fusions, we use a cervical collar, and that's typically for 6 weeks postoperatively. You are allowed to remove the collar to eat and to shower. If you do heavy bending, lifting, or twisting type work or overhead work, it's going to be 3 months before you can return to full activities.